Welcome to the Research Conversations with the Faculty of Management Sciences. Scholars committed to making impactful societal change through research.
And welcome to our podcast of Research Conversation with FMS. And today I'll be joined by Dr. Mthokozisi Luthuli, where we're going to unpack his PhD project titled Improving the Administration of Disability Grant in the South African Social Security Agencies. Well, this show is about scholars committed to making an impactful societal change through research. Dr. Luthuli, how are you, sir?
I'm good, sir. How are you?
So you spoke about the very important issue of social disability grant. So can you please maybe give us the background and context of why you decided to conduct this research?
Okay, thank you for the question. Well, the whole thing started with one of the examiners recommending, because this is from my master's study, that I actually take the study up to my PhD level, right? So then I had to read volumes and volumes of literature. The spark having been ignited by one of the authors, that is Gabrielle Kelly in Cape Town, who wrote an article about the inefficiencies and fraud that was taking place at SASSA. But she was focusing more on child support grant. Then this ignited a spark that led me, and then I said to myself, let me just, learn more about the different kinds of grants. And then it was like, the more I read, it was the more I came across disability grant fraud and inefficiencies. Then I started, reading more about specifically now disability grants and the inefficiencies that are taking place at SASSA. Then I started to design, and said to myself, let me design a study that is going to look specifically into the effectiveness of the mechanisms that SASSA uses to disperse disability grants.
Okay. Yeah. So in chapter 2, you then went further to speak about the legislative framework comparing the social disability grant of here in South Africa and abroad. So can you please maybe unpack that for us, and what did you find?
Okay, maybe perhaps let me begin by saying I used what is called a funnel view approach. Because if you are to critique something, it was very imperative for me to first know what is happening globally and then break it down to the South African context, right? So when I used the funnel view, that is to say, I looked at the obtaining literature or frameworks rather that were regulating disability, and then it all came down to South Africa, starting for an example with the types of framework like Sustainable Development Goals. Specifically the Agenda 2030 that was looking in terms of issues like inclusivity and so on and so on and so forth, because which are pretty much pertinent, issues that you can't be looking at disability without thinking about those concepts in mind. And then I broke it down to the African context, which is pretty much now talking to the developing countries, because if you're looking at disability, it depends on whether that is being implemented at the developing or developed country. So evaluating the treaties and frameworks within the African context had to do with finding out what other African countries are doing, looking at the charters that are there and other international treaties that were within the African continent, as well as other agreements. Then ultimately I was looking at what is happening in South Africa now, in terms of reviewing the policy guidelines, which were things like you have to be 18 years of age, and then you have to be a permanent citizen and must have undergone a medical assessment and so on and so forth. So it was then that I was able to now give that holistic approach in terms of how do I go about critiquing, the disability grant policy of SASSA.
Okay, so the issue of corruption is at the center of SASSA maladministration. In South Africa, our government system is leaking, and it seems like we keep on sweeping the wet floor while the roof is leaking. So we cannot say it is making progress to keep on arresting people and sweep them into jail while the SASSA administrative system is still not fixed. Which leads me to the following question. to say, can you please maybe first tell us who are these role players involved in the corruption at SASSA?
Okay, in response to your question, I'll say, remember, corruption is a formation. It doesn't take one individual to pull it off. So you will find that they've got these girls of different corrupt individuals, and please underline me when I say corrupt, because you will find a medical doctor there who will issue an invalid report saying that a person is disabled, whereas they are not. You will also have a social worker who would have issued, a report to say this client is deserving of receiving a disability grant. Then depending on the type of disability grant fraud, then you'll also find that there are cases whereby the grant, the people does not even exist. That is to say, for an example, we have a place called Boiler Room in Management that produces, non-existent identities, and then it is from that they produce, IDs and start claiming grants and so on and so forth. But to answer you, it's a gaggle of different, corrupt individuals that have come as one to form, to have a gaggle of corruption. Then eventually, then you'll start having the ordinary public members like you and me joining and paying bribes, so that they can be assessed, in a way that's fraudulent, so that they are able to receive the disability grants.
I think you've partially answered my following question to say, when you grow up in township, we have what you call Ukholela Isipoke, which means people that are getting the social grant of children that doesn't exist. So do we have any people that are getting the disability grant that are medically fit people that are getting a disability grant?
Certainly a lot. We do. You have individuals that are permanently employed, that are receiving 7 disability grants, which is about 2,000 rand.
7?
Yes. So it goes back to what I spoke about earlier, having fraudulent IDs. I'm working wherever I'm working, and I still have like 7 cards where I'm drawing disability money from, right? As long as I've got the right connections, I'm able to pull this off. And also you will hear maybe later on that I'll speak about the system disintegration, because the reason why they are able to pull off that kind of fraud is because there's nothing at SASSA that picks up that this person is now employed, maybe using their identity number and so on and so forth. So just to answer you, there's quite a number of illegitimate disability grants being issued to people that are working.
Yeah. So can we dispute these documents that are issued by doctors who approve this applicant? Because remember that as a doctor, doctors have this policy of confidentiality between the doctor and the patient. So is this something that is easy to dispute these documents that are issued by doctors? When there's someone in the community that is medically fit and is earning a disability grant, can I go and lodge a complaint somewhere else to dispute these applications that are approved by doctors?
Of course, we can. There's always a way around, dealing with corruption. Firstly, let us challenge the issue of having doctors being contracted for a maximum period of 5 years. Then we can introduce something like having rotational periods, monthly periods, whereby a doctor is only there for a month and then we bring on board somebody else. Because if you're looking at a period of 5 years, that is long enough for someone to pull off and understand where to manipulate the system and eventually, tamper with the system. And also one thing that I would say to deal with that status quo, we would rather, have monthly audit. Because if you're looking at the term once again of 5 years, then you do your reviews, you will notice that the government would have lost a considerable amount of, money. Then only then we realize. So to deal with the issue or the status quo of medical doctors, getting away with murder, then those are the kinds of mechanisms that we can introduce. Then in that way, we would have saved, the government millions of rands.
Okay, so now moving to, I think, chapter 4, of your literature review, you've introduced two theories, which is critical theory and the theory of change. So can you please maybe unpack that for us and why you've decided to choose these two theories?
Okay, well, let me say it was informed by the general rule that is applicable to anyone conducting a PhD study, which has to do with the fact that what informs the type of theory that you are going to select for your study depends on the type of literature that you are reading, right? So that is to say, the more I read about the inefficiencies and disability grant fraud and so on and so forth, and reviewing different kinds of theories, I looked at first critical theory, which has to do, with understanding human behaviors and social injustices and so on and so forth. And then it was a tailor-made theory, because I'm critiquing policy here, and I wanted to know more about the impact of the policy insofar as service delivery is concerned. Then the question was then, okay, once you are aware of these issues, that are confronting this agency, then what do you do with it? Then obviously my studies are about improving the administration, so which talks to transformation. So that's exactly what the theory of change is about, transforming the institution for the better, changes that are going to improve the agency.
Okay, so now moving to your research methodology. First, I want to start with this background. Homeless people are on their activities battles to receive a social disability grant. And I've noticed on your study, you've quoted one of the scholars called William Mashimira 2018, who reported that homeless people are failing to secure the disability grant because SASSA requires the identity document, while on the other side, Home Affairs are saying, well, we only provide the identity document on ground that the applicant has provided a recognizable physical address. So, which leads me to my first question to say, how did you choose your study participant? And the follow-up question will be, what research method that you have used to conduct your research?
Okay. Well, if I were to jog your memory, remember earlier I said this is, a developmental study coming from my master's, right? Just to highlight a bit, at a master's level, I was looking more into what is happening at an operational level. Then based on that, I then started to include, the participants that is representing both the strategic and operational views, and having dispersed the study in 3 provinces, namely Cape Town, and then KwaZulu-Natal, as well as Gauteng. Then that is to say, in the case of SASSA, I was looking at, I included the SASSA officials, both the strategic and operational views, and then I started to, include the permanent disability grant holders using specifically the provincial disability organizations, which is where all these grantees are housed. And the reason for that, it was because for me it was an easy and a smart way of getting a representation of different perceptions by grantees who are from different places of that particular province, because you'll find someone from Soweto in the case of Gauteng, and another person, from Germiston and so on and so forth, but they are all, housed in one place, and they are the recipients of disability grants, So your second question?
Your second question, what method have we used to conduct your research?
Okay, so my study was a mixed method, right? So that is to say, for the SASSA officials, because that was, a broader number of respondents, I settled for questionnaires. But however, those were some structured questionnaires using the Likert scale, and then that's how I gathered data. However, that also includes the respondents who are social workers. They are looking after the persons living with disability. Then in terms of qualitative, then I conducted interviews with 15 disability respondents per province that are coming from these different organizations.
Okay, so at the end, what sort of finding and recommendation that you came up with?
Well, the findings were that fraud is really a big sketch that the agency is facing, and there are many layers to it. So it's a question of how the institution, takes this, forward and salvage the situation. So based on what I've gathered, as part of my empirical evidence, I decided then to take all these inefficiencies, and then I designed a system called the Integrated Software Labor System. Because what I've picked up there, as you would have remembered earlier, I indicated that there was system disintegration. So I designed, or rather I introduced that system which navigates around the different issues. How do I pick up that you are employed yet you're receiving a disability grant? So that was the very first contribution to knowledge economy. And then the second one was that I introduced a service delivery charter, which is part of the value chain, and it had more to do with, dealing with the different kinds of inefficiencies that I dealt with at SASSA, for an example, being eligible for disability grants and yet rejected, and issues of that sort. So basically that's a contribution to knowledge that I brought.
Last question in 30 seconds. How does your study contribute to the body of knowledge?
It contributes in that it changes the narrative, of how disability grant fraud is looked upon, and so on and so forth. But apart from that, it also changes the perceptions. We're dealing mainly with the issues of, fixing the inefficiencies in fraud. What about the grantees, the psychological effect that they face on a day-to-day basis, and the life that they have to live? So you will notice that I also spoke about, African diasporic ways and congeniality issues that I felt was important to include and be part of body knowledge.
Well, that's absolutely. Thank you very much for your time.
Thank you, sir. Thanks for having me.
Yeah, well, viewers, that's what Dr. Luthuli unpacking his PhD project. And thank you very much for watching. This is Research Conversation with FMS. Let's meet again next time in the next episode. And thank you.
This episode was brought to you by the Faculty of Management Sciences.